Good day, everyone. We are the BSN1P Group 5, and today we are going to discuss about the types of fractures. Before that, let's learn the definition of a fracture. My name is Nicole Quilang from BSN1P. Together, let's learn what is a fracture. So, what is a fracture? A fracture is a partial or complete break in the bone. Fractures commonly happen because of car accidents, falls, or sports injuries. Some fractures can also result from medical conditions that weaken bones, which include osteoporosis, some cancers, or brittle bone diseases. Fractures which occur as a result of medical conditions are known as pathological fractures. We also have overuse or overwork, which can cause stress fractures, which are very small cracks in the bone. When we say overuse or overwork, um, this is when we exert too much effort, like carrying weights or lift, pagbubuhat ng mga bagay na hindi nakakaya ng katawan natin, which causes stress fractures. So, stress fractures are the type of fractures which is very hard na makita sa x-ray. So, kasi nga, they only cause small cracks sa bone natin. Next, we have when a fracture happens, it's classified as either open or closed. Open fracture, also called compound fracture, is when the bone pokes through the skin and can be seen, or a deep wound exposes the bone through the skin. Next, we have closed fracture, also called simple fracture, which is the bone is broken but the skin is intact. We have the types of fracture: normal, transverse, oblique, spiral, comminuted, avulsion, impacted, fissure, and green stick. That is going to be discussed by us. Now let us discuss the types of fractures. We have first the green stick. Green stick, snapping on the outer side to which it is bent, while the inner side of the branch simply bends but does not break. Therefore, this sort of fractures remain its continuity. Hence, it is classified as an incomplete fracture, where one side of the bone is broken and one side is bent. So the term green stick fracture comes from the analogy of breaking a young fresh tree branch. So from that on, green stick fractures occurs almost exclusively in children. This occurs because children's bones are soft and flexible and able to bend more than adult bone. So they can break on just one side of the bone. Next, we have the fissure, or the main term is hairline or stress fracture. In this type of fracture, the crack is so small it may not show up on an x-ray. Sabi nga natin sa umpisa, hindi natin makikita to sa x-ray kasi ang results niya lang ay small cracks. So they usually require an MRI or CT scan for diagnosis. Stress fractures typically result from overuse or repetitive stress on the bone. Ang makukuha nating main example or ang magamit nating main example dito ay ang ating mga athletes. Athletes are more likely to get stress fractures than the general population, and the breaks often occur in weight-bearing bones like the tibia, metatarsals, or femur. So, yung mga athletes kasi natin, they exert more effort sa mga practice nila. So, they practice almost every day na rin. That's why yung overuse nila sa katawan nila uh, causes stress fractures sa kanilang mga buto. Next, we have the coles. Coles, a fracture of the distal end of the radius with backward displacement of the hand. So what is a Coles fracture? A Coles fracture is a type of broken wrist fracture. It's also called a distal, away from the center of the body, distal fracture with dorsal angulation, dorsal, and upward angle. So a Coles fracture is a very painful and serious injury. Kapag nagka-Coles fracture daw tayo or yun nga break sa wrist natin, It happens when you try to catch yourself when you fall, or from traumas like a car crash. It's a painful injury that needs treatment at the emergency department. It will take months, possibly a year, para mag-heal yung break sa wrist natin. Next, we have the pot. So we have the pot. Pot. Fracture at the distal end of the fibula with injury to the tibial joint. When we say pot, these are the fractures of the tibia and fibula. And these are also most common sa mga athletes ulit, especially sa mga runners or non-athletes who suddenly increase their activity level. So many factors appear to contribute to the development of these fractures, including changes in athletic training, specific anatomic features, or decreased bone density and diseases. Fractures of the fibula sometimes occur with several ankle sprains. The fracture can happen anywhere along the fibula. Because the fibula only bears 17% of the body weight, so these fractures are not as severe as weight-bearing bone fractures.
Good day everyone, I am Karrel Rueme of BSN 1P and I'm going to discuss the spiral fracture. Spiral fractures are a type of broken bone, also known as torsion fracture. It is a type of complete fracture. They happen when one of your bones is broken with a twisting motion. They create a fracture line that wraps around your bone and looks like a corkscrew. Generally occur in the tibia, fibula, radius, and ulna. A spiral fracture can cause long-term pain issues, reduce someone's range of motion, and decrease their strength in the affected body part. Especially for those who do physically demanding work, spiral fractures can mean not just massive medical expenses, but also diminished earning potential.
Hi everyone, I am Shaira Mae Ragutero of BSN 1P and today I am going to discuss the transverse fracture. But before that, ano nga ba ang fracture? A fracture is a break from bone. Bone fracture are often caused by falls, injuries, or because of a direct hit or kick to the body. There are so many types of fracture, but as I said earlier, what I'm going to discuss to you is a transverse fracture. So, transverse fracture is a break at the right angles to the long axis of the bone. The fracture pattern is a straight line that runs in the opposite direction of your bone. It happens to any bone in your body, but usually affect longer bones after a trauma-like accident.
Avulsion fracture. An avulsion fracture is where a small piece of bone attached to a tendon or ligament get pulled away from the main part of the bone. Ligaments hold your bones, joints, and organs in place, while tendons connect muscle and bones. Like this picture shows a avulsion injury happened on a mallet finger, where as you can see in this picture, the small bone fragment pulled away with the tendon. An avulsion fracture is a closed fracture where a piece of bone is broken off by a sudden, forceful contraction of a muscle. This type of fracture is common in athletes and can occur when muscles are not properly stretched before the activity.
Good day everyone. So for today, I am going to discuss one of the types of fractures and this is called oblique fracture. An oblique fracture shows the diagonal or angled fracture line. This type of fracture may be the result of a forceful twist on a bone or impact to the side of a bone at a sharp angle. Oblique fracture are one of the most common kinds of broken bones, especially in long bones. These are two types of terms your healthcare provider will use to describe your fracture. The first one is displaced fracture, means the process of your bone moves so much that a gap forms around the fracture. The second is non-displaced fracture, are still broken bones but the process will not move for enough to be out of alignment during the break.
Hello everyone, I'm Stephanie Fhaye, I'm San Pedro, and I'm going to discuss the comminuted fracture. A comminuted fracture is a type of bone fracture characterized by the shattering or splintering of the bone into multiple fragments. Unlike a simple fracture where the bone typically breaks into two distinct pieces, a comminuted fracture results in several small pieces or bone segments. This type of fracture is often caused by high-impact injuries or severe trauma, such as a car accident, a fall from a significant height, or a heavy blow. Comminuted fractures can be particularly challenging to treat and may require surgical intervention to realign and stabilize the bone fragments. Surgeons may use hardware such as screws, plates, or rods to hold the bone pieces together while they heal.
Good day everyone, I am Hilaria Mae Semana from BSN 1P. Impacted fracture. Impacted fracture is also called as a buccal fracture. It is a break where the ends are driven into each other. This is often seen with children's arms fractures. An impacted fracture occurs when the broken ends of the bone are jammed together by the force of the injury. A comminuted fracture is one in which the broken ends of the bone are shattered into many pieces. Fractures can also be classified by their configuration. A few types of fractures are named or classified by what causes them. This includes stress fractures, sometimes referred to as hairline fractures. Buccal fractures, sometimes referred to as astorus or impacted fractures.
Hello everyone, I'm Karla Luisa Paraon and I'm going to discuss about the compression fracture. Compression fracture is a fracture caused by force from both ends of the vertebra. Spine compression happens when too much stress is placed on one or more vertebra, causing it to collapse. Over time, these fractures affect posture. Symptoms of fractured spine includes back pain, which can come on suddenly and last a long time. It usually develops anywhere between the shoulders and the lower back. Pain usually gets better when you lie down, and it worsens when you stand or walk. Second is hunch-over appearance. Some people call this curved upper back or hunchback. Next is loss of height as the vertebrae compress and the back curves. Fourth is problems controlling the bladder or bowels. These symptoms happen with severe, untreated fractures. And last is the decreased mobility or flexibility in the spine. You may not able to twist or bend over. How can we prevent compression fractures? To reduce our risk of a compression fracture, we should avoid drinking alcohol excessively, eat a healthy diet, and get enough vitamin D and calcium, which strengthen bones. Quit smoking and use other tobacco products since nicotine weakens bones and causes cancer. See your provider for regular checkups and take medications as prescribed to slow bone loss if you're at risk of osteoporosis.
Any bone fracture requires prompt treatment and should be examined by a medical professional. A doctor can realign and set a broken bone to let it heal properly. Improper healing of a fracture can result in a misaligned bone or an infection. Going without treatment can also cause permanent damage to nerves or muscle tissue. That ends our reporting for the types of fractures. Again, this is the BSN 1P Group 5. Thank you for listening and God bless.